Hello everyone, welcome to the Medical Tabs. This video is about Alzheimer's disease. Alzheimer's is a neurodegenerative disease. So the neurons, mostly present in the central nervous system, degenerate in Alzheimer's disease. The Alzheimer's is the most common type of dementia. Dementia means memory loss. So the patient of Alzheimer's disease lose their memory, both short-term and long-term memory. It's a progressive disease, onset probably at the age of 50s to 60s, and it continues increasing with age, starting with mild memory loss and possibly loss of the ability to do daily activities and loss of motor function, and ultimately leading to the loss of ability to carry on a conservation or to respond to its environment. The parts of the brain that control thought, memory, and language are most commonly affected by Alzheimer's disease. So the patient with Alzheimer suffers from brain shrinkage and lost all its ability to think, control his emotions, and to perform motor functions. So what are the biochemical causes of Alzheimer's disease? Alzheimer actually occurs due to the accumulation of misfolded proteins, mainly amyloid protein and the tau proteins. These two proteins are present inside the central nervous system and the neurons in the brain. If these two proteins are misfolded due to mutation or any other reason, then their accumulation will result in Alzheimer's. The amyloid proteins form plaques outside the neurons in the extracellular matrix of the brain tissues, and the tau proteins form tangles inside the neurons. Actually, tau protein is not the commonly misfolded protein in Alzheimer. Amyloid is the main misfolded protein, and its accumulation then results in the accumulation of tau. So this is the amyloid precursor protein. This is the cell membrane of a neuron. A part of this protein is present inside the cell and a part outside the cell. In normal signaling in the central nervous system and in brain, an enzyme called the beta secretase cleaves the amyloid precursor protein over here. As a result, the part of the protein present inside the cell is removed, and it goes and it regulates the transcription factor inside the soma of the neuron. But if this beta secretase enzyme does not work efficiently, or due to some other reasons, the cleavage does not occur at the proper site or occurs at some other site, then the resulting protein is not degenerating. The amyloid thus present in the brain cell that cannot be degenerated, they accumulate with each other and form beta-pleated sheets. These beta-pleated sheets are formed when different amyloid molecules they adhere with each other, and thus they form large plaques in the central nervous system. These plaques in the central nervous system cause a hindrance in the transmission of nerve impulses. And if they are present between the synapses, they do not let the nerve impulse from one neuron to go into the other. So the neurotransmitters here have a great amount of hindrance to be transmitted to the next neuron. In this way, they stop the transmission of nerve impulse and they hinder the actions potential generated in one neuron and result in loss of memory, loss of motor functions, and cognitive abilities. So between the synapses, they are extremely dangerous. So here's a histological diagram of the brain's tissue. These you see over here, accumulated round structures are appearing. These are actually amyloid. It is abnormal amyloid accumulating in the brain tissue. So here comes the most important part. The amyloid, which is the extracellular, the plaques of amyloid give a positive feedback to the kinase enzyme inside the neuron. Here's the microtubules. As we know that the neurons are microtubules, neurofibrils. These microtubules contain proteins called the tau proteins. So here's the tau protein. These are the tau proteins. The kinase enzyme transmits the phosphate group to these tau proteins. The phosphorylated tau proteins cannot remain as a part of microtubules, so they leave the microtubules. The structure of the microtubules is thus destroyed, and the transmission of different substances and the transport of substances across the neurons becomes difficult when these microtubules are damaged. This is how the tau proteins are phosphorylated and they leave the microtubule. The phosphorylated tau proteins then accumulate and form tangles of tau proteins. So here these vertical accumulation of tau proteins. These are called as neurofibularly tangles. Here it is another neurofibularly tangle. These tangles are formed inside the neuron. So here is the difference between a normal brain and an Alzheimer's brain. Normal brain is larger in size, whereas Alzheimer's brain is smaller. Its ventricles are large and has a great amount of cerebrospinal fluid inside it. Now, why is the Alzheimer's brain small? We already know the answer. The accumulation of tau proteins and the accumulation of amyloid proteins, they result in the atrophy and degeneration of neurons inside the central nervous system. These degenerative neurons then result in the smaller size of an Alzheimer's brain. The shrinkage of brain results in loss of all the normal functions of the body, but again, it occurs progressively. It's not immediate. It takes about 8 years to completely shrink the brain after the onset of Alzheimer's disease. So you see here the sulci of the brain. They are smaller, but the sulci in the Alzheimer's brain, they are wider due to the shrinkage. The gyri also becomes narrower, and the ventricles are greater in size. This is due to the accumulation of large amount of cerebrospinal fluid, and the cause is the same, the accumulation of proteins, which results in atrophy. So here are some symptoms which shows that the plaques and tangles buildup has started in the brain. At first, the Alzheimer's disease might not be detectable, and after some time we see short-term memory loss. The patient forgets what he ate in the morning, in the evening, or small daily activities. He forgets to do them. Then loss of some motor skills or language, if he has learned some motor skills such as piano or violin or any other motor skill. Sometimes writing is also affected. Then he might forget how to do these things. Then comes the long-term memory loss. He even forgets his spouse's name and many other things, important things of his life. Then he becomes disoriented totally. Normal functions of the body and the normal motor work is completely lost. He becomes bedridden, and finally there's death. As we know, there is no previously known treatment of Alzheimer's disease. So death usually occurs, but it takes a long time since it's progressive. It takes about 8 years to die. So what's the treatment? We have already seen no complete treatment because there's no way to stop the accumulation of amyloid and tau protein, and these misfolded proteins cannot be retried back into their original shape and form. As we know, there is no complete treatment of Alzheimer's disease. That's why death normally occurs, but the first-line agents we use are acetylcholinesterase inhibitors. These enzymes are inhibited by various drugs we commonly used in the laboratory. So what's the use of it? These drugs increase the level of acetylcholine, which is an important neurotransmitter and is responsible for memory and cognitive function. It is responsible for transmitting impulse to the next neuron. If this acetylcholine is more, then there are more chances that the nerve impulse will be transmitted across the synapse, which is already filled with the plaques of amyloid protein. Thus, it can help recover some of the memory and some cognitive functions by preventing the enzymatic breakdown of acetylcholine.